Hello everyone, I'm Dr. Aditya Punamiya, Senior Consultant in GI and HPB Surgical Oncology at SL Raheja Hospital, Mahim. Today I'm going to talk about gallbladder cancers. Gallbladder cancers in India, there is a fairly increasing number seen in the northern part of the country, and it is usually seen in 6 to 7 decades of the life, whereas it is more common in females. So what are the causes? What are the risk factors gallbladder cancers? It can be congenital or lifestyle associated. In congenital, if there is a dilatation of the bile duct, which is a condition which is called as choledochal cyst or abnormal pancreaticobiliary junction, in such cases, they have got increased incidence of gallbladder cancers in the later part of the life. Also, it is seen in females, fatty liver, and certainly patients who have got parasitic infections, the incidence of gallbladder cancers is on the higher side in such patients. So how do gallbladder cancers present? Usually they will have pain in the right side of the abdomen, which is on the right and upper side. They can have loss of weight, loss of appetite. If it is associated with infection which is called as cholecystitis, they can also present with fever. And in certain conditions, they can have jaundice, which is yellowish discoloration of the body, as well as generalized itching all over the body. So once you have got these symptoms, you need to see your doctor and a specialist at the earliest, because in such cases, it is very important to start the treatment as the earliest. Now, talking about the diagnosis, usually these patients need to undergo triphasic CT scan of the abdomen and pelvis or a PET CT scan, where it is not just diagnosing the primary condition, but apart from the location of the lesion, we will also rule out that it has not spread to any other parts of the body. Once the imaging is done, then certain tumor markers, CA19-9 needs to be done. Now, do we need a biopsy in gallbladder cancers? If it is at the earlier stage and it is operable, and the imaging features are suspicious of a mass, then in that case, we can avoid the biopsy. But in certain advanced cases where it has already involved the biliary system and where you are planning to give first chemotherapy, in such cases, biopsy needs to be done. Talking about the treatment of the gallbladder cancers, if the lesion is limited to the gallbladder and it is operable, in that case, radical cholecystectomy is performed, which is removal of the gallbladder along with 2 to 3 centimeters of the liver, and associate along with it, the lymph nodes in the region are removed and they are sent for examination. However, certain patients tend to present with gallbladder cancers and jaundice. That's because of the involvement of the bile duct by the tumor. In such cases, radical surgery needs to be done, which is usually right hepatectomy or left hepatectomy, depending upon the level of the involvement of the bile duct. But most commonly it is right hepatectomy with the hepaticojejunostomy, that is construction of the biliary tree again. Now, we face a very common situation, which is patients have undergone a laparoscopic cholecystectomy, and on the histopathology, it is showing cancer. So, do all these patients need revision surgery? We have to assess the histopathology report and the T stage. T stage, which itself says that how deep is the tumor. If it is very superficial, in that case, it may not be required, like for 1A lesions. But in case the T is deep or the depth of the tumor is more, in such case, a revision surgery is required, which is usually resection of 2 to 3 centimeters of the liver tissue, and along with it, lymph nodes are removed. If a patient presents at an advanced stage, in that case, surgery may not be possible. In such cases, chemotherapy is a very good option. The most important thing is, for the planning of a gallbladder cancers, a multidisciplinary team approach is required. We at Raheja are having an MDT team approach and cutting edge technologies in terms of PET scan and all. Thank you.